Pleasant afternoon. My name is Ina Marie O. Dizon, an instructor for Communication and Media Arts at the University of the Philippines, Mindanao in Davao City, Philippines. It is my privilege to share to you my research entitled Transforming Blaan Communities Through Communication, the case of UP Manila Community Health and Development Program. There is a societal problem that is prevalent in Mindanao. Health communication is seldom prioritized by the indigenous sector, especially in the municipality of Tupi, South Cotabato. This is supported by the UN Interagency Support Group, saying that majority of those who suffer from poorer health are the indigenous peoples group. The Blaan tribe is a tribal community in southern Mindanao, and they have extremely limited access to healthcare delivery systems. They are also susceptible to natural disasters and armed conflicts, denied access to education and land property. To address these issues, the government granted the establishment of the University of the Philippines Manila Extension Campus in South Cotabato and founded the Community Health and Development Program, or CHDP. What is CHDP? It aims to address indigenous health disparities through immersion, health communication, advocacies, and community participation among Blaans. Since the program was established in 2010, it was found out that the health communication strategies were limited and inadequate. There was no assessment on how the Blaan entities respond to the program. Communication materials were not tested. Normative changes, if any, remain unstudied. There is a need to know if there are appropriate and effective communication strategies employed by the program to transform the lives of the Blaan community. This research seeks to answer the question, how did CHDP attempt to transform Blaan communities through communication? Adedokun in 2008 said that the members of the community can only be mobilized if communication is effective. According to Floor in 2007, communication should produce transformational changes. These are meaningful changes in community practices that honor the interests of community members and transform individuals to make lives better. I employed three objectives for this study. First, find out what communication approaches the program used in transforming Blaan communities. Second, determine responses from the Blaan entities about the program. And third, identify normative changes, if any, brought about by the program. I use this framework from Floor and Smith. It is called Transformational Communication Framework in the context of environment. As you can see, there are four modes on transformational communication, namely social marketing, information, education, and communication, or IEC, social mobilization, and development support communication, or DSC. These are communication interventions needed if we aim for transformation. They also added the three elements needed to obtain normative changes: environmental literacy, environmental ethics, and environmental advocacy. So I conceptualized this into health communication context, and we came up with four communication modes, such as ICT for development, or ICT4D, health development communication, or health development education rather, systems approach to communication, and social mobilization. In order to identify if there are normative changes, there should be reinforcement of health literacy, health ethics, and health advocacy. I used closed-ended survey to explore the four modes of transformational communication, another open-ended survey to measure knowledge, attitude, and practice, and ethnovideography to explore literacy, ethics, and advocacy, which are determinant factors for normative changes. There were 24 respondents in Barangay Calcam, Tupi, South Cotabato. We focused on four major health issues, namely dengue, malnutrition, teenage pregnancy, and family planning. For the findings, the use of electronic media, such as TV and radio, was very seldom, especially in far-flung villages. It is because not every household can afford to have an electronic media at home. Also, TV and radio channels are not accessible due to lack of electrical supply and broadcast signal in the area. In terms of newspapers and magazines, only a very few respondents can take time to read and understand the news content of a particular written media. Thus, people in the community rely heavily on verbal messages articulated in an interpersonal manner. Results on health education revealed that information needs of Blaan beneficiaries have not been carried out. Often, information is not translated into dialects. Notably, the highest participation goes to dengue prevention, while a little participation is on issues pertaining to family planning and malnutrition. However, respondents claim that there is no participation on sex education and teenage pregnancy. This is supported by the statistical results on ICT 4D, which indicated that no formal lectures, communication materials, and thorough assessment about the issues were conducted. Majority of people's participation in health issues is fueled by program workers and Purok leaders. This means that listening to people and learning about their perceived needs is essential for the program. However, there were minimal discussions that primarily start with the people that involve listening to what they already know, what they aspire to, what they perceive as possible and desirable, and what they feel they can sustain. Blaan respondents' knowledge on dengue control and malnutrition are brought about by the campaign. However, their knowledge on the importance of and access to family planning methods in teenage pregnancy is not brought about by the program, but by their personal experiences and barangay health workers living in their community before the immersion. In terms of their attitude, respondents generally agree that CHDP campaigns are easy to follow, convincing, and can improve their standard of healthy living, given the limited supply of health communication materials. However, respondents doubt the sustainability of health practices when the immersion finally concludes. Dengue prevention and family planning practices are notably appropriate with the objectives of the program. This is because proper health education channels that help transfer the important information to them. Their advocacy against teenage pregnancy is also evident in the statistical results. However, respondents fail in terms of proper nutrition practices, for they still opt to choose and practice solutions that are time consuming and less effective, like feeding their children with just soup and vegetables and not seeking for immediate and more effective solutions. Lack of normative changes on dengue prevention, family planning, malnutrition, and teenage pregnancy can be attributed to inappropriate and limited development communication support materials. Also, respondents failed to sustain the health practices introduced to them due to personal factors such as unwillingness and cultural demotivation. In other words, interpersonal communication is effectively delivered, but the communication materials are not sufficiently supporting the advocacy. Shegasur in 2014 confirmed that there is still a major need to train more health workers with unique skills to meet the workforce shortage. So based on the findings, the researcher concludes that the program is currently not operationalizing the ideal health communication intervention which triggers societal transformation among Blaan entities. Thus, respondents are not yet governed by normative changes which serve as important indicators in individual and societal transformation. That's all for my presentation. Thank you all for listening.